Welcome to NAT. My name is Paul Spanos, and today's topic is the integration of psychology with faith, specifically with Christianity. With us we have Harry Malos, who is a clinical counselor with a Christian background. Harry, welcome.
Thank you, Paul. Good to be here.
Thank you for being part of our program again. It's a very, very interesting topic today. Can we just, for the benefit of the viewers, put the ground what we're talking about psychology generically?
Yes, generically, psychology is viewed as the study of the mind, how we behave the way we behave and how we think the way we think.
Okay, and from Christian perspective, when we say people of faith, what do we mean by that?
Christian people have similar understanding that they want to know how they think and what they think and how they are influenced by what they think and feel.
And that means they believe in God and they believe in the Holy Trinity, generically all the Christians.
That's right, that's right.
Now, in the past, there is a thought there that in the past those two groups, they contradict each other. Why did that happen? What was the thinking behind it?
Yes, in the past, there always was this contrast between psychology and faith, and Christian faith in particular. The contrast was that in psychology, we have scientific evidence to suggest and prove the way we think and behave. Yep. The Christian faith's premises is that we don't need to have scientific proof, that our predisposition is governed by God, and God alone is the determines what we think and how we think.
That means the whole behavior was part of the Bible or not considered at all.
That's correct.
Science.
Anything that's out of the Bible doesn't need to be addressed according to old Christian faith.
To the old Christian faith.
Yeah.
Now, what is the change that happens today? Because we're talking about the topic today is about the integration of psychology with Christianity, and what is happening now? How that integration happened?
Well, there is a bridge that we can agree on in both psychology and in Christian faith, that we can use the rich study of psychology and the scientific evidence that doesn't necessarily contradict Christian faith. And by doing that, we have what we call integration.
And is this acceptable from both sides? Accept each other? Begin to accept each other in our days?
Well, a particular school of therapies do, yes. Particular school of therapies have scientific evidence that suggests that having a faith does help us to behave in a normal and positive way.
Okay. Can you elaborate? Which school of psychology will help us to understand more Christian behavior, if you like, or people with faith?
Well, that's a good question. I would say the one that comes to my mind immediately would be the school of therapies known as CBT, Cognitive Behavioral Therapies.
Okay. And what sort of in what way this school integrates Christianity? What sort of subjects and topics it deals with?
Okay, let me give you the premise for CBT.
Okay. Yeah.
The premise for CBT is that it says that distorted automatic thoughts is what causes us to feel and think in a negative way.
Okay.
Okay, that's their school of thought. That's their headline.
Okay. That means there's some thoughts that are distorted in our minds. And,
correct.
And that leads us to negative behavior.
That's correct, yes.
Okay. Can you elaborate on that?
Well, on the Christian perspective, where we integrate, we have the letter of the Apostle Paul to the Romans.
Okay.
In Romans 12, verse 2, that says, "Don't conform to the outside world, but be transformed by the renewing of your mind."
Okay.
Now that's the bridge for integration. Okay. That it's the way that our mind thinks that we can renew to positive behavior.
That means in that case, Apostle Paul accepts the change of the mind.
The renewing of the mind.
The
rethinking of the mind.
Yes, the rethinking of the mind,
yeah.
Which in this case psychology studies of.
That's correct.
The thinking of the mind and the process of that change.
Particularly the CBT, cognitive behavioural therapy.
That means CBT is part of the school of thought in psychology. It's not everybody accepts that.
CBT is one of many therapies that are available, but it's a school of therapies. It's not just one. It's an integrated therapy as well.
Oh, okay. That having that explanation, how psychologists they work with people of faith, or help people of faith, if you like, or in our Western world that we live in, and using that science to explain the behavior.
Well, the integration aspect is that Christian faith welcomes the rich study, the empirical study of science and evidence-based theories that have shown and proven to be effective. It has welcomed that because that's something that has been proven to be right and it works. So we can't shy away from it. And therefore, and on the reverse side, particularly CBT, it accepts the evidence that people of faith have a greater purpose in life, a greater hope in life, and therefore they see that as a positive way of being in order to get people to feel better about themselves.
And that means that yourself as a counsellor, you can use that CBT as a tool, isn't it?
That's correct, yes.
The way you explain to me, can be used as a tool comfortably to...
The studies of it.
Yes, the studies of it.
The studies of it, what it has proven, the empirical testing and all the groundwork that it's done. Lots of it has been written and researched. The rich research that CBT has done that has been proven.
Thank you, and we're going to continue in a moment after a short break. Please stay with us. Welcome back. With us, Harry Malos, who is clinical counselor, and the topic today is the integration of psychology with people with faith. And there is a school of thought, the cognitive behavior therapy, CBT, called that can be used in these cases by the counselors. Harry, if I can ask you, how CBT can and when CBT can be used with someone with the problems?
Okay, well, that's a good question. The CBT premise is that the greater tragedy in life is not what actually has happened to you, but how you react to what has happened to you. How do you think about what has happened to you? How do you filter that?
Okay. That means if a tragic thing happens, or a tragic event, or abrupt event or something, my reaction to it is the importance rather more than the event in itself.
Well, you cannot change the event. Is it any way that you can change what happened?
Well, that's a good point.
No, but we can change how that affects us.
Okay.
And move on for the future.
That means the CBT, this is where it comes into it.
That's right.
To my reaction. And okay, and how, for example, if I'm completely distressed for something that has happened, an accident or something, how this tool is going to be used to help me when I'm completely distressed and I cannot accept anything, I'm just in shock.
Well, first of all, we don't like to, we address our attitude towards what has happened. We don't suggest that we could be mind readers, that the most awful thing is now going to happen. That again is distorted thinking. When we are mindful that the worst is going to happen as a result of what has happened. So we think the worst and feel the worst. We have no evidence of that, but we just think that it's going to be like that.
Okay, that means that does it help me to the behavior that follows the incident?
It doesn't help at all. It doesn't help. In fact, it makes you feel even worse. It's not so much that what has happened to you could be painful and tragic, but the actual experiencing it every day could be even more hurtful.
Exactly, because what I'm saying, that an incident or an event or a tragic story can create fears, isn't it?
That's right.
And phobias in me.
That's right. And that's what anxiety is. It's that the worst is going to happen. We start becoming fortune tellers, that this is going to happen and that is going to happen.
And then this tool now, the CBT, the school of thought, is that what it helps me to understand my behavior?
Yes.
Or to help me to improve, to be more positive?
I think it's more to improve, but it understands it as well. When we say, when you think like that, does it help you feel better?
Okay.
So
right.
Obviously they say, no, it makes it worse. Then
when I think like that means negative?
Yes.
Because of the event?
Yes.
Okay.
When you think like you know what already is going to happen,
yes.
do you have any evidence of that?
Yeah.
Are you
okay.
God? So when they say,
okay.
well, I'm not God, then how do you know this is going to happen? So we actually gently challenge the client to say, well, the way we talk is we talk ourselves that the worst will happen when we don't know the future.
Okay. Now comes the understanding of the thinking process.
That's correct.
That you help me understand using my mind, not to necessarily destroy myself.
That's correct.
Because of that incident.
Yes, we have to find ways to rethink what we think.
Okay.
As the Bible verse says.
Okay.
Be transformed by renewing of your mind. Find new ways of thinking, because the way we have thought hasn't helped us. It made it even worse, in fact.
That means instead of dwelling to the tragic event, instead of dwelling into the negative circumstances, environment,
yes.
Instead of dwelling into that, is how to move forward from that.
That's correct. That's correct.
Using the mindset.
Using the mindset and not presuming that you know what will happen. And studies have suggested that when we overgeneralize an irrational pattern, studies suggest that we never ever look back and say, this is what I thought would happen. In fact, what we do say is that what I presume that would happen has not reached its height. It never has. So we over-exaggerate our thinking process, over-exaggerate the situation. We over-generalize the situation. There's a term that we call catastrophizing.
Okay.
Yeah, we catastrophize that this is going to happen and the worst case scenario is going to be, but studies suggest that never happens. Seldom does it happen.
That means the CBT comes and intervenes into that thinking.
Yes, it challenges those thoughts.
It challenges those thoughts.
Yeah.
So it tries to stop my destructive cognitive thinking that comes in my head.
Yes, it is collaborative with the client. We don't presume to just give all the answers. We ask the questions. Has this way of thinking, has this helped you?
Okay. And
obviously they're there in the session because it hasn't helped them. So we're being a little rhetoric, but it's in order to drive the notion that the way that they've been thinking and behaving has not helped the situation at all.
Is it related to, if I can recall, Apostle Paul saying that I always put the past behind me and move forward?
Well, that's a perfect way of looking at it. That is a perfect way of looking at it, because we can't change what has already happened to us. We can't address the past as a means to fixing the future, because what has happened has happened.
Okay.
We can't change that.
Okay.
What we can change is our attitude towards what has happened.
Okay. That means that CBT really is a tool that helps me to understand how my mind can lead me in a completely negative way, or I can use it to reverse the negativeness.
Yes. And also not just our thinking pattern, but our emotions as well. CBT says that that if you think things will be at a worse position, you will actually feel that way as well.
Thank you for bringing the emotions. We will be back just to discuss that. Welcome back to NAT as we continue the discussion with the topic of the integration of psychology with people of faith and specifically Christianity with Harry Malos, clinical counselor. And we're in the stage of explaining the cognitive behavior therapy. And we did speak about the change of the mind and the renew of the mind. Now, how this process of renewing of mind touches our emotions when we have that, as we spoke, the change of mindset of being negative to turn into positive.
Yeah, well, positive thinking has a consequence on how we feel.
Okay.
Okay, so if I think positively, if I feel and think positively, then my emotional state will be a healthy one.
Now, it's going to be a strange question here, the chicken and the egg, I'm not sure about that. Is that the thinking process that affects the emotions or the emotions that affects the thinking process?
Yeah, well, we can write a thesis on that subject.
Okay.
But the point of the matter is that they both affect each other.
Okay.
But CBT is on the premise that thinking positively makes us feel positively.
Okay.
Okay. It doesn't dismiss emotions.
Okay.
But it has addressed emotions as sometimes, and it calls it emotional reasoning, that we cannot allow our feelings only to interpret reality, because sometimes our feelings can get it wrong.
Actually, we did speak about abnormal events that happen, accidents, for example, in life, that really can cause us a lot of shock in our lives. So that is an emotional state, as well as thinking about the tragic event. And that emotion stays with us, linked to the event.
Yes.
And so that's where the effect is, isn't it?
Yes.
And the thinking you mentioned now, this specific therapy helps my thinking to influence the emotions in this stage?
Yes, because it brings it to reality. If I give you a quick, our emotions, a structure of the brain, our emotions are stored in a different area of the brain that cannot analyze, cannot bring the reality of what has happened.
Correct.
But if we positively think about the event, we shifted from the place where it cannot analyze it to the front lobe of the brain that can give us reason, can give us positive thinking.
Okay. So that positive thinking sort of tries to distort the destructive emotion.
The part of the brain that stores an emotion is part of the hippocampus, and we call it the amygdala. The amygdala in psychology is where our emotions are stored, and our emotions don't necessarily cannot be analysed there alone, and we just feel what we feel, but we don't understand why. But when we bring reason to it,
that's right,
we shift it from that part and give it understanding.
That means in this case the science of psychology here uses that reasoning to help me to get out of this
that's right.
Emotional state.
That's exactly right. So if someone comes up and says, I feel depressed, so therefore my marriage is a failure, it's because he's feeling this way, which is causing him to think that way as well. You see? So we cannot always trust our emotions as the interpreter of reality.
That means this specific therapy has analyzed in such a way the change of the mind using reasoning to help other people with faith or people with no faith how to help not to go or end up being in perpetual sort of negative.
That's right.
Stick to the negative experience of that. Now, how does faith, if we go from the faith side of things, how does faith integrate with this theory? Does it help, or
yes, of course it does. Because when faith teaches us about hope, teaches us about purpose, teaches us about certain things that enable us to feel good about ourselves.
And at the end of the day, God is love, so it's a positive.
That's right. It's a positive emotion, and it's a positive thought. So when we think that way, when we have purpose in life, we actually feel better.
That's right.
Yeah.
Yeah.
We're not downcast. In
Yes.
fact, the Bible tells us a lot about why are you so downcast.
Because in this, I'm not sure if I'm right, but is this related to faith and hope? Because you can see the apostles, we can see the saints, they did not have particularly positive or rich life.
Well,
however,
Yep.
their faith and hope and their preaching is full of it.
Yes, we can push it even further and say that their experiences were
Okay.
quite harsh.
Okay. Yes.
Very
correct,
harsh.
Correct.
Yet,
And
they were
persecuted.
positive.
Yes.
How do you explain
Yes.
that?
Yes.
Their mind was positive because they had a purpose.
Yes.
The mind was healthy because they weren't thinking negatively. They knew where they were going.
Okay, that means, and in this case, the cognitive behavior therapy accepts that as a positive influence.
Yes, yes. As I said earlier on, that CBT or cognitive behavior
Yes.
therapy is well researched.
Yes.
It has researched, very rich research, and it shows strong evidence that Christian people or people of faith who have purpose and hope actually feel and think better positively.
Okay.
They cannot deny that. That's why CBT doesn't dismiss faith. It sees it as a good tool to thinking and feeling positively.
That means accepts that faith really feeds the thinking process,
Yeah.
helping those, helping the behavior to be positive instead of dwelling into the negative experiences.
That's right. It sees Christian faith as a positive filter of thinking.
Okay. It is interesting because this really CBT touches the cause of our negative behavior, isn't it?
Yes, yes. And we dwell in the negative behaviour and we're judgment focused. And there's another term in CBT that it uses, that we become the judges of others. And that's not a positive way. Does Christian faith have the same theory in that? Of course it does.
Of course it does.
Yeah.
Therefore, actually, there is an integration here, because that's what there was the discussion tonight.
That's right. Yeah.
Thank you for being with us, and it was a very, very interesting topic. And thank you, the audience, that you stayed with us. After all, there is no such animosity between psychology and faith, and as it used to be once upon a time. And there's a lot of topics that we can integrate and work together. Thank you for being with us. See you next week, same time.